Welcome back to Mountain Connections. Right now, as promised, we are going to discuss the COVID vaccine and children. There's big news coming out that kids from the ages of 12 to 15 may be eligible for that shot at the beginning of next week. We'll have to wait and see. Here to tell us about that and what we need to know is Dr. Russ Bradford, Pediatric Director at Intermountain Park City Hospital. We're so grateful that he's here with us. Thanks for being here.
My pleasure. Thanks for having me.
So what do we need to know about the COVID vaccine and children?
Well, as you alluded to, there is some exciting news coming out that we may have an approval for use of the Pfizer COVID-19 vaccine in teens beginning at age 12. So adding those 12 to 15-year-olds. Reports, at least in the popular media, suggest that it could be approved as late as this week, at the end of this week, or early next week. So we're excited to see that happen, and look forward to adding that block of important teenagers to the vaccinated group.
And Dr. Bradford, before we talk more about vaccines and this one in particular, I'd love to hear a little bit more about yourself. This is your first time right here on Park City Television. Tell me a little bit more about your background and what you've been doing right here in Park City.
Sure, thank you. I actually grew up in Park City, went to high school at Park City High School, as did my wife, and so we're longtime park guides. I moved away for my medical training, but we've been back here in the area for the last 10 years. I work as a pediatric hospitalist, meaning that I take care of patients that are sick in the hospital, and I have additional training in infectious diseases as well. So I also help direct care of patients with certain infections.
And Dr. Bradford, as we talk about vaccines, it's important to think about vaccinations as well in general with children. And many parents may have fallen behind during the pandemic simply because offices were closed. We were concerned about taking your child in to get vaccinations because you don't want them to catch something else. It's been a tough time with the pandemic. What do you recommend with parents who've maybe fallen behind or maybe thinking about getting their kids caught up with vaccines, but now you have the COVID vaccine also in the mix? What do you tell your patients to do?
Well, that's a very good point. We all had advice, especially early on in the pandemic, to avoid medical care that was not urgent. And so for many people, that meant that well-child checks and other sort of routine medical care may have been neglected, at least relatively speaking, for a few months. We're at a point now where it is absolutely safe and completely recommended to re-engage with your healthcare provider. And so if you find yourself in that position, having missed some appointments or fallen behind in vaccines, now is a great time to reconnect with your pediatrician or your family practice physicians to sort of address those routine healthcare issues, as well as to catch up on any vaccinations you may have fallen behind on in the meantime.
And
I think, go ahead.
Well, no, continue with the idea behind vaccines, making sure you're caught up, and then leading into this COVID-19 vaccine.
That's right. So one of the things that you may be aware of is that we recommend that the COVID-19 vaccine not be given within 2 weeks of any other vaccine. And that's primarily because it just hasn't been studied in conjunction with other vaccines. And we want to make sure that the dose of vaccine that you get is the most efficacious it can be. And so there may be some issues of timing around dosing of the COVID vaccine and other vaccines. But that is precisely the reason to engage with your healthcare providers, because they can talk to you about the vaccines, help prioritize vaccines, and manage the timing of those. And so we highly recommend that you that you don't wait. That go ahead and get on top of routine vaccinations in conjunction with your healthcare providers, and that you be prepared as soon as it's available, especially for those in the 12 to 15-year-old age range that haven't had that available, so that when the COVID-19 vaccine is available for that group, you're in position to take advantage of it.
And as we mentioned, the Pfizer COVID-19 vaccine has been announced recently to be safe and effective for children from 12 to 15 years old, looking like it may be available in our local area as soon as next week. If parents have questions about this COVID-19 vaccine, concerns, worries about side effects, or wondering how it may affect their children if they have other health issues, or are worried about another vaccine schedule that they're on that you mentioned, how can they find more information? Who should they talk to? What should they do?
Sure. Well, I think the best place to get advice about these sorts of things is your healthcare provider that you've been established care with already. They will have the best information about where you or your children may be in terms of vaccination status. But you can also find additional resources at intermountainhealthcare.org, as well as cdc.gov. And of course, please feel free to reach out to the local health department, who are poised to help navigate that as well.
Dr. Russ Bradford from Park City Intermountain Hospital. He is the director of Pediatrics there. We're so grateful that you joined us today about this important topic of the COVID-19 vaccine in children. Also a reminder to continue other vaccines with your child in a way that makes sense. Once again, if you have any questions, reach out to your pediatrician. You can find out more information at Intermountain online. And again, we're grateful that he joined us today. I'm sure we'll continue talking about this subject as that vaccine becomes available for kids ages 12 to 15 here locally. We'll be back with more Mountain Connections after this.